Welcome back to MLT 110. In today's lecture, we're going to be covering the unit on phlebotomy, which is Unit 4. In today's lecture, we're going to be covering the topic of capillary collection, which is another name for finger sticks. A capillary puncture is a safe, rapid, effective means of collecting a blood specimen. A capillary puncture or a finger stick is done by using a small, sterile lancet or blade to puncture the skin or the capillaries in the tips of the fingers to create blood flow. There are different types of lancets that you can use to create a puncture in the skin. There are lancets designed that have a swinging type motion. That would be this type of lancet that is pictured here in the top right hand corner. This type of lancet with the swinging motion are designed to make a little bit more blood flow from the end of the fingertip. If you're wanting a little bit higher volume of blood, then they are lancets that have a more of a piercing motion, meaning that the lancet or the needle within the lancet comes straight down and just pricks the finger, and it would result in a little bit less volume as far as blood flow from the capillaries. And of course, here are some examples of what lancets look like. Here are the safeties that would need to be removed in order to expose the needle on the end of the lancets. The needles are up within the lancets itself, and then the button needs to be pressed in order for the lancet to be released down in order to prick the fingertips or the capillaries. Again, the swinging type motion would rake and open up more capillaries to result in a higher flow of blood from the fingertips, and then the straight down prick would result in a little bit less volume of blood from the fingertip. The blood tubes that we use for capillary collection are usually smaller in size and they hold less blood. So these are some examples of our capillary collection tubes. Some of the capillary collection tubes can come with a capillary tube attached to them. This is just to help aid in collection of drops of blood as they come out of the fingertip, or they can come without those capillary tubes added in. They're going to do the same function as far as collecting blood, whether they have the capillary tubes included with them or not. Also, you can see down here, this is an actual lancet in use. A lab tech is using another style of lancet to prick the finger, and we're going to talk about positioning of your lancet here in just a minute. Another thing to note and mention on the slide before we move on is the different color of tubes means they have different preservatives or different additives in the tube, and also the different tubes and different colors of tubes are used for different tests. For example, our purple top tube or our lavender top tube, it has EDTA in it, and it would be used for all our hematology testing. So when would we perform a capillary puncture versus a venipuncture? Well, let's first discuss what a venipuncture is. A venipuncture would be when you're collecting a blood sample straight from the vein. So an example of that would be when you're drawing blood with a straight needle from an arm vein. You might want to collect a capillary versus a venipuncture when only a very small volume of sample is needed. Also, another time to collect a capillary versus venipuncture is when you're dealing with newborns or infants under 1 year of age. And because infants are so small and their little fingers are so small, we usually use a heel stick and we collect from the capillaries of the heel versus the capillaries of the fingertips on our infant. And you can see this being done in the image that is on this slide. There is a lab tech or a nurse that has used a lancet and has pricked the capillaries in this baby's heel, and they're collecting into a capillary tube for this baby's blood sample. Another time you might want to choose a capillary stick versus a venipuncture stick is when a vein might be hard to access or difficult to access on a patient. This might be a patient with a lot of burns or a lot of scars. It might just be easier to collect your sample from a capillary stick in the fingertips versus trying to find a vein in the arm or another location on the body. There are times when a capillary puncture might not be ideal for collecting a sample. One of these times might be if a patient has edema. Edema is swelling, and you can see there's a lot of fluid, in particular this person's foot. Also, if a patient is very dehydrated, if you're just puncturing the capillaries in the tip of the finger, if a patient is dehydrated, they might not bleed very much for you, and you might not get a complete specimen, and the specimen not be a high enough volume where it can be tested. And lastly would be patients with poor circulation. And again, it might be hard to get patients with poor circulation to bleed for you, and you may not end up with the volume you need for testing if you just do a capillary puncture on a patient that has poor circulation. So what is the composition of capillary blood? What makes up our capillary blood? It's a mixture of blood from your arterioles, your ventricles, and your capillaries, and also interstitial blood. So if you don't know what interstitial blood is, it's the substance that fills the area between your cells. It contains things like water, amino acids, sugars, and salts. But most often our capillary blood resembles our arterial blood. So that's why there's a difference between our capillary specimens versus our venous specimens, because our venous specimens are coming from our veins directly. This is why it's always important as a lab tech or phlebotomist to document if our samples are coming from a capillary puncture versus a venous puncture, because it's going to make a difference in our normal ranges. Capillary samples are typically not used for coagulation testing. This is testing looking at the ability for blood to clot. And the reason capillary samples are not used is because capillary samples contain tissue fluid from the fingertips, and that can affect coagulation test results. One last thing I want to mention on this slide before we move on is the difference between arterial blood versus venous blood is that arterial blood tends to be more oxygenated because arterial blood has just picked up oxygen from the lungs, and venous blood samples are deoxygenated or are oxygen poor because the blood is being carried back to the heart from the body to be reoxygenated. Okay, as promised, we are going to discuss the best location to perform a capillary puncture on your patient. In adults, the best place is going to be on the side or the fleshy area of the finger, and we're typically going to use either the middle finger or the ring finger, and the blue area is the side of the finger or the fleshy area where we're going to place our lancet to actually perform the puncture. Also going to choose the non-dominant hand if possible of the patient, and this is just if our capillary puncture ends up causing a little bit of the soreness on the fingertips, it's a little less bothersome to our patient. I will go ahead and tell you sometimes in capillary puncture some fingers bleed better than others, so in order to get the volume that you need for testing, at times you may have to puncture multiple fingers. This is not ideal, but sometimes it happens. On our infants and our newborns, again, we're going to do our capillary punctures on our heels or the fleshy part away from the bone on the heel. So here on the side where the blue area is where we would place our lancet in order to make the puncture site for the capillary collection. Under 1 year of age is usually when we complete a heel puncture. If they're able to stand or above 1 year of age, then we can do a regular capillary puncture. These are just some more images showing where you want to complete your capillary punctures on your hand. Again, you want to go kind of to the side. You can complete the capillary puncture on any of the fingers, but again, we want to go for the middle or ring finger if possible. Again, for the babies and infants, we're going to go to the fleshy side of the heel. In preparing your patient for a capillary puncture collection, you can warm the site in which you're going to perform the collection, and this improves circulation and blood flow. There's a few different ways that you can warm the collection site. You could have your patient just to wash their hands in warm water. You could give the patient a warming pack. This is an example of a warming pack that they put on a baby's heel when they're going to perform a heel stick. You could also put warm water into a glove and tie the glove off and just have the patient hold the glove for a few minutes in order to warm their fingertips. And again, all this is in an effort to improve circulation and improve blood flow. And of course, before we perform any kind of puncture into the skin, we want to cleanse the site where we plan to perform the puncture. We're going to cleanse with alcohol. Some alternatives to alcohol we could use to clean would be iodine or chlorhexidine. When we clean, we always want to clean in a circular motion in one direction. When we're performing capillary punctures, we want to wear our PPE to protect ourselves. Again, our PPE is our personal protective equipment. In the classroom, when we're practicing our capillary puncture, we're going to be wearing gloves, our lab coat, and our face shield. In the clinical setting, the PPE that you wear may vary depending on the clinical site, but you will at least be wearing gloves. So let's go through the exact steps that you'll need to go through in order to perform a capillary puncture. The first thing you want to do is wash or sanitize your hands and put on the appropriate PPE. Then secondly, you want to choose the puncture site. And again, if you're doing the finger puncture, you're going to be looking for the fleshy side of either the ring finger or the middle finger. Thirdly, you'll be cleaning the puncture site that you've chosen with an alcohol swab. Fourth, you will hold the finger and pull the skin taut, and you will press the lancet firmly onto the finger. The fifth step is you'll be puncturing the skin in one quick, steady movement with the lancet, and we'll practice this in class. The sixth step is to wipe away the very first drop of blood that comes out of the fingertip. This is important because the very first drop of blood that comes out of the fingertip contains a lot of tissue fluid, and it can contaminate our sample. It also can activate the clotting of the blood, and we don't want that. We don't want our sample contaminated, and we don't want clotting activated. Make sure to use clean gauze to wipe away this first drop of blood. The next step in capillary collection is the seventh step, which is called milk the finger. This is not just squeezing the fingertip, because if you just squeeze the very end or the fingertip, you're going to end up with more tissue fluid in your sample. You want to work all the way down from the knuckle of your finger down to your fingertip in order to push more blood down to your puncture site so you can collect the blood into your capillary tube. During the milking process, you're going to squeeze and release your finger about midway of the finger between the knuckle and the fingertip, and this is going to allow blood to flow down the length of the finger. And if this is a little confusing, that's okay. We're going to practice this in class as well. Okay, so once you have milked the finger and you've got a drop of blood on the tip of the finger that you need to put into the collection tube, you don't want to put a lot of pressure on the end of your finger and scoop up that droplet of blood, because again you're going to end up with tissue fluid. You want to just easily allow that blood to kind of drop into your tube. And again, this is something that we will practice in class, but you want that droplet of blood to kind of easily drop into the tube. You don't want to scoop it off your finger, and then you may have to tap the capillary tube on the tabletop or the countertop in order to get that blood to go on down to the bottom of your tube, because you want that blood droplet to come in contact with the additives like the anticoagulants that may be in the tubes. Once you have completed your capillary collection and you've got the volume of blood that you need, you can cap your collection tube and invert your sample so you can mix it with any additives that may be in the tube, because if it's an anticoagulant tube, of course you don't want your blood to clot. Another little trick or tip that you could use if you're still trying to collect the correct volume of blood and your finger site begins to clot, you could use an alcohol swab to wipe the area to try to dislodge any clot and see if you can get the blood to start flowing again. After the capillary collection is complete, you want to take care of your patient. You want to hold a gauze on the puncture site up to 3 minutes. If a patient does refuse a bandage, you want to make sure that the puncture site has stopped bleeding before the patient leaves. For patients that are on some anticoagulant therapies such as Coumadin or aspirin, you may have to hold the gauze on a little bit longer, up to 5 minutes, in order for the patient to stop bleeding. So just be aware if a patient is on some type of blood thinner. At the end of a capillary collection, we recommend you use gauze versus a cotton ball when we want to stop the flow of blood. Sometimes when we use cotton balls, the cotton fibers can stick to the puncture site, and when we pull the cotton ball away, the platelet plug comes out with those cotton fibers, and it can cause our puncture site to reopen and the patient can start bleeding again. This last slide is just a summary of all the steps that are involved in the capillary puncture. You will be receiving in class this as a handout. If you want to look at each step a little bit more in detail, you can pause the video at this time. This concludes our lecture on capillary punctures. We'll be doing a lot of practice of capillary punctures in class, and our next lecture will be on venipunctures.